This program is brought to you as a community service of BAF Insurance. The views, opinions, and advice expressed by guests on this show are those of the guests and do not reflect the views, opinions, and advice of BAF Insurance. For medical advice, please visit your medical professional.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Welcome to Your Health, Your Wealth with Desiree and Chuck on Bobo Radio. Thanks for listening. Please stay with us for the next hour while we share health tips and chat with our special guest.
Welcome, everyone, to Your Health, Your Wealth, brought to you by BAF Insurance. Your Health, Your Wealth airs every Wednesday from 6:30 to 7:30 a.m. right here on 89.1 FM Bobo Radio. Remember to tune in each week and tell a friend. You can also catch the shows you missed on YouTube on the Be Well, Be Healthy for Life channel. So don't forget to subscribe and like and share.
As you know, we're still in Women's History Month, and we salute Caymanian women who helped build the Cayman Islands. And since we're talking about health, the National Trust recently highlighted Nurse Yates as a pioneer in health.
Nurse Erskine Leela Yates, 1899 to 1996, was a revolutionary nurse, beloved midwife, and resident of West Bay. Nurse Leela's home was built by her parents, Arthur and Jacinta Yates. The home was built in 1917 after their original home that was located at the junction of Northwest Point Road and Town Hall Road was destroyed by the hurricane of that year. The following year, Nurse Leela began her nurse's training and walked to Georgetown every Monday and Friday to attend classes. She carried out her first midwifery case single-handedly in 1921 and continued to deliver over 1,000 babies in their family home or in her own home before the government opened its hospital in 1952. She never lost a baby or a mother. Nurse Leela retired from the midwifery profession in 1971 and was recognized posthumously as a national hero of the Cayman Islands.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
And with that being said, that is a wonderful story for any young person who wants to enter into the world of health. As we make the transition from the past to today, and we're still talking about women's health, our guest today is Dr. De Alwis. He's a gynecologist with Total Health, Inc., and we're going to talk about women's health as it relates to modern times.
Let's go straight to some of the topics that affect women today. There's a lot of women who suffer from infertility for different reasons. Do you mind just saying what some of the reasons are?
Good morning, and thank you so much for having me. It's a pleasure. The problem with infertility is worldwide because 1 in 6 couples need treatment to have a baby. And if you talk to a couple who's trying to have a baby, they will tell you that it's the most painful exercise in all their lives. There are those who have miscarried several times. Then there are those who have never got pregnant. The fault in these cases is threefold. One is 33% of the fault may lie in the girl, 33% may lie in the boy, and 33% may lie in both. But the common thing is for doctors to investigate the girl first, and I don't agree with that. I think they should investigate both of them at the same time. I have quite a few men, some are 6'2", who are unable to produce enough because they don't have the volume or the number that needed to make a girl conceive. They are tall and 6 foot tall, but they don't have anything, some of them. So it's important to investigate both partners simultaneously. Otherwise, you're doing unnecessary tests on the girl when in fact the problem is with the boy.
Okay. Is it because they think it's a fault of their own?
Yeah. One of the main concerns is their parents often question them, why don't you have a baby? And they will ask the boy, is something wrong with you? Shall I send you my cousin who has children? And they will insult it as well. So it's quite a stigma where we go to party and others have children and you don't, and they ask you in front of everybody, why don't you have a child? And it's embarrassing as well because some people think that this one never has a child, but it's not true. There's hardly anybody in this world who can't have a child. Almost everybody can have a child. You have to target the appropriate problem. For instance, in a girl, obviously you have to have a vagina, you have to have a cervix, you have a uterus, you have to have fallopian tubes, you must have ovaries, and the fallopian tubes must be patent or they must be open. Then in the case of a man, he must have enough volume, the sperms, the number of sperms, and he must have an erection, he must be able to make love. In all these areas, there are gaps in many people. You'll be surprised about the number of people we have who have tubal pathology. Tubal pathology means the fallopian tubes are destroyed due to some kind of infection. And one of the biggest problems in the Caribbean is we give antibiotics to the couple when the girl has an infection and the boy does not take it. I find that of my patients, more than 50% of the boys will refuse to take the tablets. And they say, nothing wrong with me, the problem is with her. And that poor girl takes the tablets. She goes home. After a week, she gets it again. So naturally, the chance of getting pregnant is less. Chance of getting ectopic pregnancies is more. Fortunately, we've been targeting these patients a bit more and attacking them, and now the incidence of ectopics have come down, and the chances of getting pregnant have gone up. In my clinic, certainly, I hardly ever see somebody who doesn't have a baby, because if a person doesn't have fallopian tubes, we can send them for test tube babies or in vitro fertilization. So there are avenues for everybody.
Okay, so IVF is definitely an avenue that you can offer someone within your clinic that comes to visit you.
Certainly, if the investigations show that the fallopian tubes are not working, it shows that the eggs are not good, then they can borrow eggs from a cousin or a sister or a friend and have the sperm injected. It's called ICSI, intracytoplasmic sperm injection. And then you can have about 5 days later, there'll be about 4 or 5 babies. You can take 2 and put them into the girl, and at least 1 will take. So there are avenues in all these cases, even if there are no tubes, even if there are no fallopian tubes. And in the case of men, if the sperm count is low, we can give them medications to improve the sperm count and make them more fertile.
Dr. De Alwis, do you find that after hearing a little bit, that culture plays a lot in the thought process of what we're going for? Because, I mean, we were talking about the negative stigma and also the resistance from men to not only take medicine, but also be understanding of the situation. Do you find that plays a lot into it?
That's very true. Most of our men don't like to take that amount of responsibility. They would rather avoid a girl getting pregnant for quite some time, and for them to be much more mature or older or achieve greater heights in their academic career and think of pregnancy later on. Even the girls, they will leave childbearing till 32, 34. By that time, some of the tubes are lost. Complications have come in. Whereas if you look at certain countries, their children start having children by the time they're 17, 18, 19, 20. Now, those people have greater chances of pregnancies. And by the time they're 25, they've had their 2 children and they're studying again. So it is very important that their parents guide them, not force them, but guide them to say, don't wait till you're 35, because at 35, 1 in 360 girls will have a Down syndrome baby. 1 in about 290 girls will have an abnormal child.
Wow.
At 40 is 1 in 100. At 50 is 1 in 1. So
those are staggering numbers.
If you leave it for too long, you're asking for trouble. Miscarriage rate is higher after 39.
Talking about the Cayman Islands, one of the things that most first world countries push is education, get your accolades, get your money, get all of this, and then think of family. Then when you have achieved all of the greatness that you want, then we have the idea of, I'm going to slow down now and get my family in order. But the rest of the world thinks of it as the reverse. Family, as they say, family come first, and then all of the other things you build upon. And not that one is right or wrong, but if you do it that, I want to say, first world way, you risk a lot of complications, and also having an older population with a gap with the younger population. It kind of, would I say that numerically correct in that, doctor?
That's very correct. That's what is happening in Europe and many countries. Even in England, the older population is increasing, and the younger population is now not that great. So if they don't have 2 or 3 children in each family, after 30 years, the indigenous population will go right down. They have done it statistically and proved it. And that's happening because everybody wants to get degrees and go up the ladder and, as you said quite rightly, become very rich and very powerful people, which is good. But if you look at the reverse side of it, now some people in certain countries, now for instance in Ireland, they don't practice contraception that much, and they'll have children, at least the first child, before 20. And there's very little infertility compared to the rest of the world. Then there are certain, I don't want to be talking about religion, but there are some faiths that stop you from using any contraception. And those people have children before the age of 20. And as you quite rightly said, the people who study and achieve heights and so on and leave it till 32, 34, then the chances of getting pregnant are less. When the child is 20, the mother is 54. So they can't even play with the child or enjoy the grandchild and so on. So you're pushing everything back, and the chances of enjoying the children are less than had you had your first child before the age of 28.
Wow. Take a little pause. We're going to come right back. And I want to talk to Dr. De Alwis about women's health. I'm a man, so I really want my listeners to have a more rounded idea of women's health here in the Cayman Islands, and some of the things that we discussed earlier. And also from the perception of the marketing side of it, because, nowadays it's hard to watch television and not see 2 or 3 products for females. And you think, okay, does this work? We'll talk a little bit about that when we come back, all right?
Yes, great.
You're tuned in to the wonderful program each and every Wednesday morning. We kick off from 6:30 to 7:30. Ms. Des, tell them who we are.
We are Desiree and Chuck, Your Health, Your Wealth. Please subscribe, like, and share.
We'll be right back.
In celebration of Women's History Month, BAF Insurance salutes the women of the Cayman Islands. We know that everyday women are superheroes every day, helping others, loving and nurturing, taking charge and building our country's future. Happy Women's History Month from BAF Insurance, providers of quality affordable health insurance for individuals and groups of all sizes. Give us a call at 949-5089.
Your health, your wealth, your health, your wealth, your health for life.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Let's check in with Lady K as she talk about avoiding common household pollutants.
Today on Be Well, Be Healthy for Life, Lady K, your wellness coach, talks about household pollutants.
Did you know that no matter how clean your house is, there may still be pollutants lurking around your corners and in the air? The U.S. Environmental Protection Agency has noted that excess moisture, volatile organic compounds, carbon monoxide, and radon are 4 major indoor air pollutants. Then there's pollution caused by burning stoves that use fossil fuels, such as gas, kerosene, or standing over charcoal grills, which can actually cause tiny particles of soot to penetrate deep into your lungs and could eventually cause irreparable damage. Pet dander is another common indoor pollutant. Whether you realize it or not, your indoor pet is constantly shedding hair or fur, and your vacuum cleaner or your broom can only remove a limited amount of the allergy-causing pollutants. And for the folks who love burning candles and incense, and I am one of those folks, even these give off particles that reduce the air quality in your home. However, in this episode, I want to focus on one type of pollutant known as VOCs, or volatile organic compounds. These are organic chemicals that vaporize and turn into gases at normal room temperature. We can't see them or even realize they're there, but they can still have effects on our health. Okay, now take a moment to subscribe to the channel if you haven't already done so, while I go ahead and explain a bit more about the VOCs. No matter how often we dust, we wipe, we disinfect, and generally keep our homes free of clutter, we may be subject to pollution from VOCs. They may be emitted from everyday products we use, including aerosols, spot removers, clothes we pick up from the dry cleaners, or floor waxes, and even air fresheners. Other common products such as our laundry detergent, disinfecting wipes, deodorants, and perfumes that we wear can also emit pollutants. To be honest, you would have to decide to live in a bubble to totally avoid indoor pollutants. And even then, the pollutants in the plastic that built your bubble, that would also be an issue. So it's all about minimizing the number of pollutants you use and the effects they have on your health. Let's start with choosing your household cleaners. Environmentally friendly and store-bought natural cleaners can be expensive. So if those are not within your budget, then opt for something you may already have in your kitchen, such as white vinegar. Its corrosive and acidic properties make it an excellent cleaner. It's relatively inexpensive and not harmful to your skin. Word to the wise, avoid using vinegar on granite or marble countertops, as the corrosive effects could damage them. Nevertheless, vinegar and lime juice both contain some antibacterial properties that increase with heat, so they can kill many of the pathogens that are found in your kitchen. If you must use harsh chemicals, such as bleach, for example, make sure you use them in a well-ventilated space and wear gloves and a mask. Open windows and doors and allow the chemical odors and the particles to escape completely before closing them again. Now, let's talk about those aerosols. Air fresheners, body sprays, and can disinfectants are all notorious pollutants. During the current pandemic, most of us have used larger than normal amounts of disinfectant sprays and wipes. And while we've been doing that responsibly to prevent illness, we also may have been harming our health. More people are suffering from allergies than ever before, and some of these alarming statistics can be directly traced back to the overuse of pollutants from disinfectants. So look for natural air fresheners in the grocery store or the pharmacy. They will be more expensive than the ones you may be used to, but they're well worth your health. Or better yet, try placing baking soda in containers throughout your home to absorb odors. Use beeswax or soy candles, which are non-toxic. Potpourri made from dried flowers and herbs are great. You can use essential oils or invest in an activated charcoal air purifying bag. All these are non-toxic ways to keep your home fresh and clean while minimizing VOCs. As our environment changes and the products we use evolve, whenever possible, choose the most natural, non-toxic products you can afford. And when all else fails, remember, a lot of the totally natural and kitchen food products used by our foreparents worked well and are a lot less harmful to our bodies and to the environment as a whole.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
And remember, the Be Well, Be Healthy for Life podcast with Lady K is also sponsored by BAF Global Group and can be found on YouTube, Spotify, TuneIn, iHeartRadio, Podcast Addict, and Podbean podcast platforms. Her episodes are released weekly on the BAF Facebook page as well.
That information was super informative. Speaking of being informed, let's talk to one of our BAF representatives.
So we're here today with BAF agent Sharon Spencer. Sharon was just awarded Sales Champion Award for 2022. So she's going to be in the hot seat for 3 minutes. Chuck, are you going to start the timer?
That's right. We are all set. First question, Ms. Sharon. Tell us, how did you initially become interested in the insurance industry?
Funny thing, Chuck and Des, I became interested in insurance by being friends with an insurance agent. He used to normally come by my workplace. We have long talks about insurance, the risks of not having it, and the good thing about having it. And I decided to ask him, what's the requirement to become an agent? As his job had sounded so interested, the way he talked about helping people. So that was the start of my career in the insurance industry, just by asking a simple question, what's the requirement? That's how I started.
So Sharon, what do you enjoy the most about providing health insurance?
Meeting new people, helping people to put one of the most important thing in place, health insurance.
Has there been a specific client situation that has made a difference in how you view the importance of your job?
Yes. A couple of years ago, I completed an application form for a customer who decided to wait to make payment for us to effect coverage. That person became ill, went into the hospital. The bill was
astronomical.
Yes, it was. And since then, I believe if I did maybe take another route in regards to reminding or educating this person, a
little more persistent.
Yes, with the person, then that plan would have been in place and his hospital bills would have been covered by the insurance company instead of him finding money to take care of his medical bills.
Well, that's your 3 minutes, Sharon.
Your health, your wealth, your health, your wealth, your health for life.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
You're listening to Your Health, Your Wealth on 89.1 FM. I am Desiree, co-host of Your Health, Your Wealth. I'll be with you every Wednesday from 6:30 to 7:30 a.m. Your Health, Your Wealth is brought to you by BAF Insurance as a community service because at BAF, your health is our priority. Remember to stay on top of your regular health checkups because, as always, the more you know about your health, the easier it will be for you to stay healthy.
And remember, if you missed the first half of the program, you can always catch up on what you missed with the Be Well, Be Healthy for Life YouTube channel or on a number of podcast platforms, including Spotify, Podcast Addict, and iHeartRadio. Just look for the Be Well, Be Healthy for Life channel on all these platforms and remember to subscribe.
It's time for us to welcome back our special guest, Dr. De Alwis. He's a gynecologist with Total Health.
Welcome back to Your Health, Your Wealth, Dr. De Alwis. Earlier, we talked about fertility issues. In this segment, I'd like us to take a look at cancers and product placement in advertising as it relates to women's health issues.
This is one of the commonest problems in Cayman, where we see 30 to 40% of patients who come in will also complain of a discharge, and they call it yeast. Now, every discharge is not yeast. Yeast is a fungus. So it's a common parlance at parties. They say, I had some yeast, I took over-the-counter medicines. But what is important to realize is that there are what are called normal-like discharge, abnormal-like discharge, but very, very abnormal discharges, which you won't know about. Normal ones, say when a baby is born, first 2 weeks there will be a little discharge or a little blood-stained discharge due to the maternal hormones. That is normal. Then when a girl ovulates mid-cycle, there will be a discharge which is higher. That is metal smirts. It's common during ovulation. Then after that, when they are sexually aroused, they'll have a higher discharge, which is normal. During pregnancy, there will be a higher discharge, which is also normal. Now, those are the normal categories, and you can put bacterial vaginosis into that as well. But when you come to the abnormal ones, you can have anything from gonococcus to chlamydia to various other infections that are pathological for the internal organs. But the worst ones are, you can have a carcinoma of the cervix, carcinoma of the uterus, carcinoma of the fallopian tubes, carcinoma of the ovaries, carcinoma of the vulva, vagina, and the presenting complaint may be just a discharge. And if you think every discharge is yeast, you're going to miss a cancer. Mm-hmm. I've seen several cases where they present with just a discharge and they had a cancer. Because a discharge is just a secretion from an organ. It's not necessarily yeast. It can be yeast if you take a course of antibiotics, or if you have diabetes, if you are immunocompromised, then you can have yeast infection, especially if your partner was not treated at the same time. So the yeast goes from one to the other. But that's not a harmful organism. Yeast is a simple organism. Even children have it. And there are other frightening experiences where from the age of about 3 years of age to 8 years of age, if the discharge is bloody, it can be a tumor called sarcoma botryoides, which is a carcinoma in 3 to 8 year old. So if you say that blood stain discharge in young girl is yeast, you're missing a cancer, and it's a fast growing cancer. So you have to be realistic and see, is this a significant discharge or is it just a normal discharge? If you're not sure, go to your doctor, get it checked. He can do the swabs, he can look at the put a speculum in, look for any infection, look for any tumors, do a scan if necessary, look for any lumps and bumps, because it's very easy to miss a tumor, even for a doctor. I had a case where the tumor was about 10 pounds and it was missed by doctors. I had another case where the tumor was 38 centimeters by 30 centimeters, and it was missed by a well-known specialist consultant from Britain. So doctors are human, they can make mistakes. Mm-hmm. So if you have a discharge or if you have a symptom that is persisting despite taking treatments, get a second opinion. Get it checked out and see whether something is wrong with you.
But you would agree that early detection and managing your checkups and whatnot, that is the absolute best way to go. The
cardinal thing in medicine is number 1 prevention, number 2 prevention, number 3 prevention. So you have to, there is no alternative. So you got to do your pap smears. You got to get yourself checked if you're over 40 with mammography and so on, and do self-exams, examine your breast yourselves. Mm-hmm. And if there's a family history of any type of cancer, say in the pancreas, in the large bowel, in the intestines, and so on, because those are connected. The pancreas, the large bowel, the intestines, the ovary, the uterus, breasts, all are connected like cousins. So if one has a cancer, you must check the others. It's very important. So you need a good family history. If in the family there are cancers in those organs, check the other organs also. There's nothing lost. And especially when you're 40, do your mammogram and do your self-exams. Some authors used to say about 10 years ago, don't do self-exams. It's a waste of time. But that's not true. You know your breast better than anybody else. So examine yourself regularly. And if you find a lump, go to a doctor and say, doctor, I never felt this before, but I've got it now. And I've had several cases like that, at least 3 cases in the last 5 years, where the patient comes and tells me, doctor, I found a lump when I was in the shower. Not seen by a doctor, she has on her own come and said, I have found a lump. That's great. Otherwise, they have to go to doctors and say, doctor, do a checkup. But these 3 girls found it in the bath by themselves.
Right.
Hats off.
Early detection.
Early detection. Hats off to those 3 girls, and now they're fine.
Okay. Dr. De Alwis, I want you to kind of strongly admonish women, especially women, because we are, by nature, we're caretakers, we're nurturers. We like to take care of everything. We take care of our husbands, we take care of our families, we take care of even our extended families, some of us, and we also take care of our friends, but sometimes we neglect ourselves as women. So I want you to kind of issue a warning about neglecting your self-care and taking time for yourself. I want you to kind of say how important that is to us, especially as women, since we're still in the Women's Health and History Month?
I agree with you totally. The part played by a girl or a woman or a mother in the family is incomparable. You can't compare it. If you have 2 children, that means you have 3 because the husband is there. So
True.
The biggest child is the husband. And I'm being honest because he's so dumb. He wants everything done by the wife.
Exactly.
But this is true. So if you have 2 children, you have 3. So it's your responsibility to look after all 3 because ultimately the blame falls on you. No question. If something goes wrong in the family, blame the mother. Vaccinations are not given, mama, why didn't you give the vaccine? You know, and basically the important things must be imparted by the mom. For instance, they must wipe backwards towards the back. Then if they are using soaps, try and use simple soaps like baby soap. You don't need scented soaps. Those are the worst. You must never use colognes, perfumes, powders down below. Use nothing or use baby soap and wear cotton underwear. So the mother must check, is my child wearing nylons? Nylons heat them up. Is my child wearing the wrong type of clothes when she's at home? You can wear loose clothes. You don't have to wear these tight jeans at home and make it hot and cook those areas. Let them breathe. Because the more they breathe, the better it is, especially for men. If a man wears what is called jock straps and jeans, the sperm counts will fall, no question about it. Whereas if you wear nothing at home and just a loose pair of shorts or pyjama, like short pyjama, that's the best because you can see it breathing. So the basic things fall on the mother's lap. Everything that is important in the house, from storing money to collecting money to banking money to seeing that the husband doesn't overspend, to see that the children are vaccinated, see that the children have their pap smears. You can have pap smears anytime if they have sexual intercourse, 1 year from the first act of sexual intercourse. See that they've got their Gardasil vaccines in 0, 6, 2 and 6 months because it can prevent certain types of cervical cancer. And see that anybody in the family over the age of 35 or 40 is checked up for ovarian cancer. You can do a cancer marker. So there are so many things that the mother is expected to keep an eye on.
Okay. What can you tell us about the HPV vaccines that they just started, I guess, within the last, I don't want to say how many years, but I know it wasn't around when I was growing up.
It's been a huge campaign on TV and radio and things of this.
Tell us the importance, like the real importance.
Now, HPV vaccine is a blessing because in countries like Scotland, they started vaccinations from the age of 11. There are some countries that even say take it at 9, but 11 is good enough. 11 to about 45 years of age is the recommended thing in most countries. And there are several types of the Gardasil. One is the Gardasil per se, which has only 4. Then there is another one called which has about 9. And there's another one that has even more. So you take them at 0, 2 and 6 month intervals. And there's a new one coming up which can be given only 2 doses. By giving these vaccinations, you minimize the chances of cervical cancer. But don't forget that these HPV types do not only cause cervical cancer, but they cause penile cancer, throat cancer, tongue cancer, anal cancer, scrotal cancer. So they're causing cancer all over the regions. So it's frightening, even in the throat, because it's human papilloma virus, it's a virus. So I believe that people have HPV, they get worse in the presence of other infections. And the funny thing about STDs, they don't come alone. Sexually transmitted disease comes with a cousin or a friend. So if chlamydia comes, that organism might bring gonococcus, might bring something else. So if HPV comes, the HPV might bring chlamydia. And chlamydia will reduce the immunity of those cells close by. And when the immunity goes down, the HPV starts climbing even faster. So the bad thing about the STD organisms, they bring a cousin with them sometimes.
Okay. We're wrapping up this morning with Dr. De Alwis, but before we go, I want you to tell us exactly how to get in touch with you. If somebody wants to make an appointment, what is the easiest way to do so?
At the moment, I'm running 2 places. Very soon, I'll be running 3. But in the mornings, I'm at the doctor's hospital, which was formerly called CTMH, Chrissy Tomlinson Memorial Hospital. So I work there from about 7:30 till about 12:30. Then I go to Total Health, and I'm there from about 12:30 or 1 till about 8. So the whole day is gone, and very soon Dr. Tomlinson wants me to see a couple of patients in Savannah as well.
Okay.
So, and I see patients from HSA as well. So it's that's because I think I did every exam in the world. There's no more exams to do, and I'm boasting if I say I'm perhaps the most qualified in the whole of Caribbean, because I did every exam in the world. So as a result, the doctors want me to see some of their patients, which is a great honor, and I'm very grateful to them.
And I have to tell you, out of all of the interviews, the most informative comes from somebody calm like you. Your demeanor, your understanding. And I say that for the gentlemen out there who's listening to me, who are afraid to go with their significant other, to see a doctor, to have these conversations. Gentlemen, you need to know as much as your wife, your significant other does, because one day you may be asked to make that call and make that drive, and you need to have information.
And there are single fathers as well.
Yes, and I say that because I have a 15-year-old girl, and I need to know this information because this is what's going to help me help her. And with that being said, thank you so much, Dr. De Alwis.
You're most welcome, and you're quite right. I see men as well. I got lots of men coming to my clinic, so it's open to anybody. And I agree with you totally that by talking about these things and educating the public, especially the men, because girls are not stupid. They have read, they have been exposed to the literature in schools, whereas boys are playing all the time. They don't bother about these things. So I think it's important to teach the boys and vaccinate them as well at the same time as the girls for HPV.
Perfect.
Yes, because we never used to hear about the males getting the HPV vaccine.
Oh, they get penile cancer.
Yeah, but we never, I mean, that wasn't what was pushed. It was the girls that were.
That was never on the radar for any sort of campaign,
I'm telling you, this is the
paper
first
or literature.
This is the first that I've actually heard.
No, I have seen penile cancer, I have seen scrotal cancer, I have seen anal cancer coming from this HPV. So if you, and a lot of people don't know they have HPV. So even when you're doing a pap smear, doctors don't do HPV unless you tell them to. If you say, doctor, please include HPV, they'll include it. Otherwise, they do standard pap smear. And then you won't know you have HPV.
So again, there's some new information.
You have to ask the doctor everything. Because the doctor might think, if I ask, shall I do the HPV, she may be insulted. So I'll better not ask. Whereas, in fact, she wants it. And if she wants it, it's best that you ask. There are many times doctors are not pushing the boundary a little bit, thinking that I might offend the patient. But in fact, the patient wants to know. So I think it's best to be well informed and tell the doctor, doctor, is there anything else that you think I should do or I could do that you have not done? Then he will say, no, I haven't done your HPV. If you want, I'll do it. Or I haven't done your HIV, VDRL for 5 years. Then she will say, yes, please include that.
Yes.
Okay.
You know?
Okay.
Perfect. Thank you so much.
My pleasure. Thank you so much for having me. It's a great honor.
Excellent.
We'll have you back again.
Thank you so much.
Definitely. Keep it right here. We got more great information coming up. This is Bobo 89.1 FM in the early morning time as we approach our 7:30 marker. Keep it right here. We'll be right back.
In celebration of Women's History Month, BAF Insurance salutes the women of the Cayman Islands. We know that everyday women are superheroes every day, helping others, loving and nurturing, taking charge and building our country's future. Happy Women's History Month from BAF Insurance, providers of quality affordable health insurance for individuals and groups of all sizes. Give us a call at 949-5089.
Your health, your wealth, your health, your wealth, your health for life.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Today on Be Well, Be Healthy for Life, Lady K, your wellness coach, talks about building our immune systems.
During this pandemic, there's been a lot of talk about building our immune systems. Our immune system is a complicated network of cells and proteins that protect our bodies against infection. The real miracle of the immune system is that it keeps a record of every germ it has ever defeated, so that it can quickly recognize it and begin fighting it the next time it appears. This is why it's so important that we build, strengthen, and maintain our immune systems. Think of your immune system like an army defending a country against attack. Just like the army, the immune system needs nourishment to mount a viable attack. And although there are still relatively few studies on the effects of nutrition on immunity, there is no doubt that good nutrition helps our body's systems. You'll want to share this episode with someone. It's very important that you do. And remember, subscribe to the channel and hit the notification button so you'll know whenever a new episode is uploaded. There are tons of products on the market that claim to boost our immune system. Many health experts agree that boosting the immune system isn't really something that can be done easily because it's a system and not a single organ. Harvard Health goes as far as to suggest that boosting a number of cells in your body, immune cells or otherwise, is not necessarily a good thing. Nevertheless, our bodies are constantly producing immune cells, and so what is required is that we give our bodies the nutrients and the healthy environment it needs to produce those cells. Let's talk about a few of the foods that help your immune system perform at its best. When we think of fighting off a cold or the flu, what's the first thing we turn to? Vitamin C. Readily available in all citrus fruits, oranges, lemons, limes, tangerines, and grapefruits, vitamin C helps to increase the production of white blood cells that fight infection and therefore aid your immune system. Your body doesn't produce or store vitamin C though, so it must be ingested daily to have long-lasting benefit. Here's an immune booster that I'm sure you didn't think about. Red bell peppers, or sweet peppers as most of us call them. Ounce for ounce, a single red bell pepper contains almost 3 times as much vitamin C as an average size orange, and it's very rich in beta carotene, also helpful for the immune system. What about other vitamins such as vitamin E, which is a powerful antioxidant that is vital to a healthy immune system? You can get plenty of vitamin E from almonds, which also contains good fats that help our bodies to absorb this fat-soluble vitamin. Sunflower seeds, not the salted roasted kind, is also rich in vitamin E, as well as hosts of other minerals, including selenium, which has the potential to combat viral diseases. Many of us are already aware that garlic helps to fight off infections. This is probably due to the high levels of allicin, a sulfur-based compound that helps the immune system work effectively. Ginger and turmeric are both known for reducing inflammation, which is a common symptom of infection, and turmeric also has antiviral properties. When it comes to your immune system, remember, it's a system, not an organ. This means several key factors are necessary to make it work. In addition to eating right, your immune system will benefit from regular exercise, getting adequate sleep, maintaining a healthy weight, and of course, staying hydrated. This pandemic could be around for a while longer. Let's do all we can to defend ourselves against an attack.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
Thank you, Lady K, for that information. And remember, the Be Well, Be Healthy for Life podcast with Lady K is also sponsored by BAF Global Group and can be found on YouTube, Spotify, TuneIn, iHeartRadio, Podcast Addict, and Podbean podcast platforms. Her episodes are released weekly on the BAF Facebook page as well. If you're just joining us, we're in the 7 o'clock hour, and you're listening to Your Health, Your Wealth with Desiree and Chuck on Bobo Radio. We're here with you until 7:30 with a host of health tips and information to help you and your loved ones live healthier, happier lives.
Your health, your wealth, your health, your wealth, your health for life.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
And we are back, folks. We're going to be talking to BAF Insurance agent Miss Sharon, who just happens to be, what's her official title for the 2022?
She's the sales champion of 2022 for BAF Insurance in the Cayman Islands.
Awesome, awesome, awesome. Miss Sharon, first question, tell us a little bit about the initial procedure in applying for health insurance with BAF.
Well, we need a completed application that is completed accurately. We'll need 2 identification photo IDs from the applicant as well as the employee. We'd also need the immigration status, maybe a copy of the PR grant, a copy of the work permit, or a copy of the person's Cayman passport with the initial premium, and that is for individual. For groups, we would not need the initial premium because we normally would invoice that client at the end of the month.
What kind of plan would you recommend for a family of 4? It's a husband and a wife and 2 young children that are below the age of 10.
BAF has a wide range of plans to suit every need. And what I would do would discuss the benefit summary of maybe 3 or 4 individual plans with this family in order to help them to make a decision.
And for a young adult between the age of 20 to 23 who's in good health but they need both dental and vision coverage, what kind of plan would you perhaps suggest for those?
I would suggest a more comprehensive plan that has a wider coverage of inpatient and outpatient as well as dental and vision, because this person has youth in their favor. And with youth in your favor, you may not have medical records in regards to pre-existing condition, etc. So therefore, you're locked into a lower premium being a young person. So I would advise the person to be enrolled in the value plan enhance.
Okay, right before the 3 minutes is up, we need you to give us your contact information, the best way to get in touch with you, because as the sales champion of the year for 2022, you could actually do a follow-on and be another sales champion of the year 2023. So give the public your contact details. What's the best way to get in touch with Sharon Spencer?
For individual and group health insurance, you can contact Sharon Spencer at 327-8747, 814-2542, or you can call our office direct line 949-5089.
Thank you, Sharon, and thanks for being here with us this morning.
Time's up.
Your health, your wealth, your health, your wealth, your health for life.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Well, that's our show. Lady K gave us some tips as well as great information on building our immune system and recognizing common household pollutants. Remember to check out Lady K's videos on the Be Well, Be Healthy for Life channel on YouTube. Or if you're a podcast listener, you can find all her episodes on Spotify, iHeartRadio, TuneIn, Podcast Addict, or Podbean. Just look for the Be Well, Be Healthy for Life channel.
And don't forget to subscribe, like, and share with your friends. Those videos are life-saving health tips brought to you free by BAF Insurance. The YouTube channel is Be Well, Be Healthy for Life. You can also catch up on Your Health, Your Wealth shows that you miss on the same channel.
We also heard from our guest, Dr. Desiree Alwis, gynecologist with Total Health.
Until next week,
we are Desiree.
And I'm Chuck Taylor, encouraging you to start now
to live a healthier and happier life. This program is brought to you as a community service of BAF Insurance. The views, opinions, and advice expressed by guests on this show are those of the guests and do not reflect the views, opinions, and advice of BAF Insurance. For medical advice, please visit your medical professional.
In celebration of Women's History Month, BAF Insurance salutes the women of the Cayman Islands. We know that everyday women are superheroes every day, helping others, loving and nurturing, taking charge and building our country's future. Happy Women's History Month from BAF Insurance, providers of quality, affordable health insurance for individuals and groups of all sizes. Give us a call at 949-5089.
Your health, your wealth, your health, your wealth, your health for life.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.